Are you ready? Hi, come in. Come and take a seat right there. It was nice to see you. So you are the next appointment that I have. You have been booked in for the full, complete physical. Just want to make sure everything is good for the brand new year. Good. Okay. Well, I was sent your details by Dr. Dreams. I believe you previously came in for a color deficiency, a color blindness test. Is that right? Okay. So reading her notes here, it looks like everything seems pretty normal. There is a note here that says, check if I am colorblind. You know what, maybe that has to do with her. I will just shoot her an email and ask her what that's about. But you don't think you're colorblind, do you? No. Okay. Well, that was interesting. I don't worry too much. That's not an issue. We will get straight to your session. Okay. I'm going to start out just by looking into each of your eyes. Alright? I want to check the health of your eyes, so I'm going to be coming in pretty close. Alright? Okay. You can just keep looking at my nose. Right on this side. Good, that looks fantastic. Your eyes seem to be looking pretty good. If you'll just look up for me, please. Good. Okay. And this eye, look up. Fantastic. Okay. That is great. Your eyes seem to be in good health. I'm going to now use a quick laser that I have just to look into each eye. So if you will just take this and cover each of your eyes for me, please. You can start with whichever one that you want, okay? And I'm just going to take a look into each eye, and my computer will pick up if there's anything that is noteworthy. Alright, okay, so just look ahead, or look at my nose rather. Alright, okay, zoom, zoom, right, zoom, zoom. Good, okay, I think that's good. Then let's use this one. This one uses a different color light, so it sees different parts of you, of your eye. Okay, zoom, zoom. This one, zoom, zoom. Good, how did that feel? A little bright, yeah. I mean, that's totally normal though. Don't be too concerned. So, good, okay. I just have some tools here. The primary goal is just to see, again, we are aware from the test that you have no color deficiency, but I just want to make sure that we are on the same page with these colors, because the following test requires that you look at each color. Alright, alright. So if you will just tell me, what color is this? Blue. That's good. That's right. Alright. And this one? Red. Yes. Good. And this one? Green. Fantastic. Alright. This one? Yellow. Good. And finally, pink. Alright. That's great. Okay, so we're going to start out. So I'm going to give you an array of instructions, and if you'll just follow them, if there's anything that's unclear, let me know. Alright, but we are going to start with these two, so the yellow and the pink. Alright, so if you will please keep your eye on the yellow pen. Good. Okay, and now can you change to keeping your eye on the pink pen, please? Good. Okay, and if you'll just keep looking at my nose, alright, and then if you can tell me when each one goes out of your peripheral, so at which point you can't see it anymore. Alright, I'm going to start with the yellow, okay, and just say when. Good. Alright, the pink. Good. Okay, and again. Good. Alright. Good. Okay. Good. Good. Fantastic. Alright. That is so good. Okay, and now we're going to perform a similar test, but this time with green and blue. These colors can sometimes give a different reading. It's very interesting. I am sure that I know everything about it. Okay, so please keep your eye on the green pen. Good. Okay, and remember, keep your eyes on the green pen, please. That is good. Alright. Fantastic. And now we're going to do the same thing, but this time with the blue pen, please. Okay. Good. That is excellent. You're doing so well. Good job. Good. Okay. Alright. Fantastic. Amazing. That's looking so great. Okay. Now, what I need you to do, please, I have the red pen. Okay. And we're going to cover each of your eyes, and then you can follow the pen, please. Alright. So I'm going to just use this. Good. Okay. Good. Good, alright, and this side. Fantastic. Okay, and now just using both of your eyes, if you'll please follow the pen. Good. Okay. Oops. So, okay. This time I'm going to need you to please look at my nose, alright? Okay. Just keep your eyes on my nose. side. Alright, and I just need you to please look now at the red pen. Okay. Okay, good. On this side, look at the red pen, please. Good. Okay. I just need you to, this is a little bit uncomfortable, but I just need to blow a little bit of air into your eyes and just have a look inside. Okay. It is more of a fright giving, but not like scary. It's unexpected. Okay. All right. Okay. So I'm going to come in here. Alright, that's good. And this side. Good, okay. And same thing. Okay, going to go on this side. Alright, and this side. Good, okay. Yes, so these results indicate to me that your eyes are in very good health. You do have what might be termed as a lazy eye, but it's more like an eye that is lazy, and the best way to combat that is exercise. We usually suggest some weightlifting, some skipping. Yes, your eye needs to do that. Okay, good. Okay, and we just have one more part of the test. Good. Okay, I'm going to cover each of your eyes. Okay, one at a time. Okay, and please read to me the numbers from the top. 5, yes. And I need you to go down as far as you can until you can't see anymore. 7, 4. Good. 3. Good. Good, fantastic. Alright. And let's go ahead on this side. Alright. 6, 7, 8. Good. Okay, you can't read that last line. Yeah, you see, that was that eye that is lazy that I was talking about. He just doesn't really want to do work, it seems. Alright, so then I'm going to come in a little bit closer. Okay, and if you could please again cover each eye and read to me, okay, from this line. Okay, so start with the numbers, please. Okay, exactly. And then there is the letter E. If you can tell me if it is facing up, down, left, or right. There are 3 of them. Okay. Okay. And then the letters following that. X, X, good. Do you see the number 8? Okay. And after that, there's those scary fraction looking things. No. I don't even... Oh, that... that might be for me. I wonder. Alright, so... we're going to go again. If you can try where the 6 is. The 6. Okay, and tell me what you can read. That... okay, no. Alright, that's not a problem. Okay, well, let's go to the line above. Good. And the letters E, which directions are they pointing in? Right. Good. And then the last 3 letters. Okay. Good. And that number? Yes. Okay. The number is for me, but I just like to test if people are able to see it. Okay. And then we have one more eye test, alright? We're going to go in, okay? And if you can read to me, please, all of the lines starting at the first one with the letter E and go down as far as you can, alright? Good, alright. Good, okay. And the third line. The 4th. Good. And the 5th line. Yes, that's good. The 6th. Alright, and the 7th. Okay, it's starting to get a little blurry there. Okay, do your best. Okay. And that last line, are you able to see anything at all? Alright, okay. And we're going to do the same on this side. Okay, so again, this is that eye that is lazy, so don't be too hard on yourself. Alright. So there, the 1st, 2nd, good, 3rd. Alright, and the 4th? You can't, okay. Well, what can you see? Cats? Okay, I don't think that's right, but that's okay. We, fortunately, you're in the Dr. Dreams hospital, and that one does just give me pause and makes me think that perhaps I might send you to another doctor. She is down the hall. Her name is Dr. Dreams. Dr. Dreams, yes. She is actually in psychology, or at least in mind doctoring. She looks inside your brains, and she has a bunch of tests that can help see in your heart and figure out, particularly why you're seeing cats. That's quite unusual, but nothing to worry about. Overall, your eyes are they look fantastic. I'm very, very happy with that. The eye that is lazy, so remember, a little bit of exercise. Yes, okay. Yeah. Push-ups, some weight training. Yeah, skipping is always a good one. Yeah. Well, good. That's good. Okay. I might see you around the hospital. I know you're coming in and popping into each of our offices for your appointments. So good. If there is anything peculiar or anything else peculiar with your test, I will let you know. Call you up and we can talk about cats. Alright, that's good. Thank you. Thank you so much.